Sexual consent, attitudes, beliefs, and norms. Gender norms are also associated with rape-supportive attitudes and beliefs, and collectively, these attitudes, beliefs, and norms may influence how consent is communicated and understood. As such, it is important to examine how common antecedents of sexual assault, such as rape myth acceptance, token resistance, and masculinity may influence sexual consent and, in turn, be associated with sexual assault. Rape myth acceptance. Endorsement of rape myths or rape myth acceptance, RMA, is an important risk factor consistently linked to sexual aggression. As such, many sexual assault prevention education programs focus on reducing rape myth acceptance as part of their programming. Rape myth acceptance refers to endorsing attitudes and beliefs that are generally false but are widely and persistently held, and that serve to deny and justify male sexual aggression against women. There are myriad ways that rape myth acceptance is linked to sexual consent. For example, people who accept rape myths may believe that sexual assault stems from a misunderstanding or miscommunication of interest or consent to engage in sexual behavior. People who endorse rape myths may conceive that victims were unclear in their communication of sexual refusals and therefore led the perpetrator to believe the sexual behavior was consensual, or consented to sexual behavior but then regretted the incident and claimed they had been sexually assaulted. According to Silver and Hovig, 2018, rape myth acceptance and lack of adherence to consent are shown to have a reciprocal effect on each other, with rape myth acceptance leading to the tendency to engage in sexual activities without obtaining consent, while such sexual aggression reinforces rape myth acceptance. Considering that traditional sexual scripts position women as sexual gatekeepers, men who endorse rape myths may be inclined to believe that women are responsible for bluntly and obviously refusing sex. Therefore, if non-consensual sex occurs, it is because women were not clear in their consent and refusal communication. Further, people who endorse rape myths may be less inclined to obtain consent because these traditional sexual scripts, embedded in power differentials reinforced by traditional gender roles, idealize men's use of aggressive tactics to obtain sex as the prescribed sexual initiators, and women's acquiescence as part of a normalized sexual consent negotiation. This in turn may influence beliefs and attitudes about consent communication, as research indicates. College students believe women should wait for men to initiate sex. Some men report intentionally engaging in sexual behavior without asking to avoid women saying no. And some men seem to use aggressive tactics as part of consent negotiation. There is empirical evidence that lends support to these theoretical associations. For example, men's endorsement of passive consent, i.e., assuming yes until one hears no, is associated with rape-supportive beliefs, including rape myth acceptance, and men's endorsement of rape myth acceptance is associated with greater intention to engage in sexual behavior without consent. Additionally, men with lower consent comprehension, i.e., greater inclination to report coercive and aggressive behaviors as acceptable methods to obtain consent, had higher levels of sexual assault perpetration, and men with a history of sexual aggression seem to have a difficult time discerning consent from women, especially when the consent cues are implicit, nonverbal, or ambiguous. Further, men with a history of perpetrating coercive or incapacitated sexual assault were more likely to endorse passive consent, and men with a history of sexual assault perpetration were less likely to report seeking sexual consent or adhering to their partner's sexual consent decision. Related, Lowe et al. 2007 also reported that men with a history of sexually aggressive behavior perceive sexually aggressive and non-aggressive behavior differently than men without a history of aggression. As such, sexually aggressive men may not distinguish between consent and refusal cues due to lack of comprehension or disregard. Researchers have not teased apart the mechanism, and as a result perpetuate sexual assault. Hurst and colleagues, 2017, provide support for this argument, as they found that men who reported a history of perpetration were less likely to ask for sexual consent or adhere to their partner's refusal. Taken together, there are clear associations between rape myth acceptance and consent communication, which can lead to sexual assault. Token resistance. Endorsement of token resistance may also influence consent communication and be related to sexual violence. Some men disregard refusal cues because they do not perceive them to be genuine. This is an example of a specific type of rape myth known as token resistance. Token resistance refers to the belief that women do not mean no when they say no to sex, and they intend to consent to sexual activity. Men's belief that women use token resistance has been linked to misperceptions regarding consent. For example, men report thinking female characters consented to engage in sexual intercourse because they consented to other behaviors such as kissing, despite the female character indicating she did not consent to sexual intercourse. In another study, men who endorsed token resistance were less likely to support obtaining explicit consent and less likely to recognize sexual assault in various scenarios. And men who endorsed token resistance were more likely to report using semi-aggressive consent communication tactics. There are a few explanations that may help contextualize why some men endorse token resistance and how it relates to consent communication. First, college men may endorse token resistance because it fits with traditional sexual scripts in which men are expected to ask women for consent, women are expected to refuse sex, at least initially, and men are expected to ignore such refusals and continue to pursue a sexual encounter. Thus, men may believe it is expected that they continue to pursue sex post-refusal. Second, it is the social expectation that men achieve sex, potentially through whatever means necessary. In such instances, men may be motivated to think that women's refusals are token, so they can achieve their desired conquest. Finally, men may also perceive token resistance as a hurdle they can overcome. When confronted with a refusal, men may endorse the notion that the refusal is token because they can ultimately convince women to change their minds and consent or at least acquiesce. Masculinity. Masculinity has been conceptualized in a variety of ways, and, situated in the context of traditional gender roles, certain aspects of masculinity may be theoretically associated with consent communication. For example, hegemonic masculinity encompasses the notion that men should be in a dominant position in society, whereas hostile masculinity purports that men feel distrust of women and insecure around women. Both hegemonic and hostile masculinity legitimize men's control over women. A third type of masculinity, precarious manhood, suggests that men's masculinity is tenuous, and thus men are consistently forced to demonstrate their masculinity to maintain their position of authority and dominance in society over women. Finally, hypermasculinity describes exaggerated male stereotypical behavior and emphasizes that holding degrading sexual attitudes toward women and endorsing violence is masculine. Reinforced by traditional sexual scripts, these different masculinities may influence consent communication. Endorsement of hegemonic and hostile masculinities reinforces men as sexual initiators seeking sex and consent, and women as sexual gatekeepers. If women refuse men's sexual advances, it may reinforce feelings of precarious manhood, which in turn could contribute to men's engagement in hypermasculine behaviors such as sexual violence. Although there is not empirical work directly linking these different types of masculinities to consent communication, a number of studies have linked these constructs to sexually aggressive behavior. Men's endorsement of masculine norms is also associated with poorer understanding of consent. Authors theorize that men's beliefs regarding dominance, power, and entitlement influence how they make sense of consent. That is, men who ascribe to traditional gender norms associated with hegemonic and hostile masculinities and hypermasculinity might be less likely to acknowledge women's consent and refusal, which in turn increases their risk of engagement in sexual aggression. Theoretically, hypermasculinity may promote men acquiring sex from women as an endorsed performance of men's traditional gender roles. However, when women rebuff men's advances, some men may feel threatened, reinforced via precarious manhood, and therefore inclined to react in hypersexual and hypermasculine ways to prove their social dominance over women, hegemonic masculinity. This expression of hypermasculine behavior may take the form of sexually aggressive behavior, including being generally aggressive or ignoring women's refusals and continuing to pursue sex post-refusal. Collectively, men who endorse these types of hostile and sexist beliefs may be more inclined to subscribe to rape myth acceptance or disregard sexual consent and refusal cues from women, particularly when women's sexual desires and thus communication cues are inconsistent with what men want, i.e., achieving sex. These men may also rationalize sexual aggression by subscribing to the notion that women's refusals are token, women can be convinced to consent, or the more nefarious notion that women deserve to be forced into sex, perhaps because they led men on or otherwise communicated some intention to have sex. Part 2. Addressing sexual consent in the context of sexual assault prevention. The body of research summarized thus far demonstrates the relationships among consent communication, gender norms, and attitudes and beliefs commonly associated with sexual violence, highlighting the complexities associated with consent. It is important to consider this information when contemplating sexual assault prevention initiatives, specifically initiatives that focus on consent promotion and men. 3 approaches to addressing consent in the context of sexual violence prevention are reviewed as follows: consent promotion in the context of sexual assault prevention programs, consent promotion initiatives, and affirmative consent policies. As each of these efforts represents a distinct approach to addressing consent, they can be used as standalone efforts or used concomitantly as intersecting components of a larger, more comprehensive sexual violence prevention strategy. Consent promotion sexual assault prevention. Sexual assault prevention initiatives have been around for decades. The focus of such programs has evolved in response to our understanding of the sexual violence landscape. Prevention initiatives focus on a range of topics, including reducing rape myth acceptance and other rape supportive attitudes, increasing victim empathy, and increasing bystander behavior, i.e., pro-social third-party interference, to name a few. The overarching goal of these initiatives is to reduce sexual assault perpetration and victimization. Consent promotion is another sexual assault primary prevention topic. However, consent is rarely the central focus of most prevention programs. Instead, consent tends to be embedded in programs ancillary to other dominant messages, e.g., promotion of bystander behavior. For example, according to 2 older reviews of sexual assault prevention education, a very limited number of programs address topics related to consent, such as increasing communication generally and dispelling rape myths pertaining to consent and token resistance. According to DeGue and colleagues' 2014 systematic review of sexual assault primary prevention strategies, only 2 programs explicitly mentioned addressing topics related to consent: the men's program and the sexual harassment and rape prevention program, SHARP, Consent 101. Other programs include information on communication and setting boundaries more generally, which may be related to consent, but this information does not appear to explicitly address sexual consent. It is difficult to determine how much of the program focuses on such information. For example, one program comprises 2 one-hour sessions and another 5 sessions, but a range of topics are included in each program, so comparing the type, amount, and format of consent information across these programs is challenging. Male-focused prevention programs with content pertaining to consent. According to Newland and O'Donoghue's 2016 more recent review, programs targeting men that focus on elements of consent seem to show promise. This review identified 6 specific interventions that target men and identified 3 that demonstrated some success in reducing sexual assault victimization or perpetration behavior. Although not the central feature, these programs do include elements of sexual consent. For instance, as part of the men's program, men learn the basics of defining sexual consent, and the men's project includes a discussion of consent. Specifically, authors note that definitions of consent are discussed and operationalized in the context of specific scenarios. According to DeGue et al. 2014, Both programs demonstrate promising preliminary findings, but additional research is warranted. Finally, the Real Consent Program, a web-based intervention that focuses on increasing pro-social bystander behaviors, also aims to increase knowledge of the elements constituting effective consent for sex. It is encouraging that all three of these programs seem at least somewhat effective in reducing sexual assault victimization or perpetration. Each program contains multiple components, including at least limited information on consent. However, it is not entirely clear which elements positively influence any attitudinal or behavioral outcomes. It is also not apparent if elements of the program related to consent directly or indirectly contribute to the program's effectiveness. As such, it is unclear the extent that consent education or consent promotion specifically are effective in reducing victimization and perpetration behavior. Consent promotion initiatives. In contrast to these three programs, SHARP specifically focuses on consent. However, it does not focus on men exclusively. This program consists of one 10 to 15-minute session aimed at increasing people's knowledge about consent and understanding of consent. Preliminary findings demonstrate success. However, researchers caution that this brief intervention should not be considered a comprehensive approach to sexual violence prevention. Rather, it should be used as a tool to supplement more comprehensive prevention education. As such, consistent with the Men's Project, the Men's Program, and Real Consent, SHARP could be embedded or included as a discrete component within a larger sexual violence prevention strategy. Public media campaigns focused on consent promotion to combat sexual violence have also emerged as alternative mechanisms to address sexual assault. These initiatives move beyond traditional workshop-style or even web-administered approaches to reach a wide audience via visual media and posters. For example, consent promotion social marketing campaigns comprise posters that promote messages of consent in general, e.g. Got Consent, promote messages of explicit, affirmative, and enthusiastic consent specifically, e.g. yes means yes, that eroticize consent, e.g. consent is sexy, or that provide other important information regarding consent, e.g. consent can be revoked. Preliminary findings suggest that when campuses implement such campaigns, college students seem to be aware of these posters, and among those that are aware, students tend to think positively toward the messages promoted in the posters. Additionally, consent promotion poster initiatives such as the Consent is Sexy CIS campaign also seem to be relatively successful in increasing positive attitudes toward consent and increasing sexual communication for those in relationships. However, it is worth noting that gender differences emerged. Specifically, women reported more supportive attitudes toward consent, greater perceived behavioral control regarding asking and communicating consent, greater perceived salience of sexual violence as a relevant personal and social issue, and more systematic processing of the consent posters than men. These gender differences were mediated by rape myth acceptance. In other words, men processed the consent posters differently and perceived sexual violence as less salient than women as a function of their endorsement of rape myths. As such, these campaigns may have limited effect on people who endorse rape myth acceptance, particularly men, as they tend to endorse rape myths more than women, and are at greater risk of perpetrating sexual assault. The authors conclude that designing campaign messages that reach men and others with high rape myth acceptance likely hinges on their ability to make this denial of rape more difficult. It is also worth noting that increasing positive attitudes toward consent is a promising outcome of the poster campaign, but it may not equate to increased explicit consent communication behaviors. Previous research suggests that college and high school students tend to define consent in narrow terms, consistent with affirmative consent. In practice, however, they tend to rely on nonverbal cues and no-response signals, which is inconsistent with affirmative consent. Researchers speculate that college students may be responding in these ways because they know how they should respond with regard to consent. This could also be true among participants providing responses to the consent poster programs. The Define Your Line program, another consent promotion initiative, is a student-driven campus-wide social media campaign aimed at increasing student dialogue regarding consent. Unlike the poster campaigns, Define Your Line is a consent education program that aims to promote clear and applicable definitions of consent to university students. The program claims to be successful in reaching students comprising groups at risk for perpetration, but historically difficult to reach with other educational interventions, e.g., men in fraternities. Like the consent promotion poster campaigns, Define Your Line seemed to increase positive attitudes toward establishing consent, perceived behavioral control to obtain consent, and students' intentions to ask for consent prior to sex. The program also increased people's intention to stop sex if consent is not given, if it is rescinded, or a partner is silent. Consistent with the consent poster campaigns, the effects of this program on sexual victimization and perpetration, however, have not been assessed. Affirmative consent policies. Consent promotion initiatives have also taken the form of affirmative consent policies and standards implemented by colleges and universities that aim to increase explicit consent communication. For example, in 2014 and 2015, California and New York were the first two states in the United States to pass state-level legislation mandating that institutions of higher education in their state adopt affirmative consent policies. 3 additional states also passed similar legislation: Colorado, Connecticut, Illinois. Although most states have not passed state-level legislation mandating universities adopt affirmative consent policies, many institutions of higher education in the United States have revised their sexual misconduct policies to define sexual assault in terms of affirmative consent. In this context, affirmative consent is generally defined as an informed, voluntary, and mutual decision among all participants to engage in sexual behavior. Accordingly, affirmative consent means that consent can be communicated via words, behaviors, or actions, provided that the communication clearly indicates permission regarding willingness to engage in sexual activity. As such, silence, lack of response, lack of saying no, and lack of resistance in and of itself do not indicate affirmative consent. Consistent with other consent promotion initiatives, e.g., poster campaigns, the purpose of these policies is to promote explicit consent communication. Consent promotion initiatives, including these policies, represent a shift from the no means no standard for defining sexual assault to a yes means yes or affirmative standard. In addition to promoting more explicit consent communication, some have indicated that an ancillary goal of affirmative consent policies is to normalize and perhaps eroticize consent. However, understanding the efficacy of these policies is challenging. One study examined how different ways of framing the affirmative consent policy may influence support for the policy, compliance with the policy, and reinforcement of traditional gender norms. Researchers compared a deterrence or punishment framing, i.e., offenders will be deterred from not obtaining affirmative consent by punishments that are swift, certain, and severe, with a normative compliance framing, i.e., people will use affirmative consent because they feel morally obligated to obey legitimate authority, not because they fear punishment. Gender differences in people's response to the framing of the policy emerged. Specifically, men had increased support for the affirmative consent policy associated with the punishment framing, whereas women had increased support in response to both frames. The latter point suggests that women may have increased support for affirmative consent simply through exposure to the policy, disregarding framing. Interestingly, framing did not seem to influence men's compliance with affirmative consent, whereas the normative framing actually decreased women's compliance. The punishment framing also, surprisingly, had a negative effect on women's compliance, but to a lesser extent, and the punishment framing seemed to increase the salience of gender stereotypes in men, particularly men's perceptions that most people think men are more powerful than women. This finding suggests that the ways in which affirmative consent policies are framed could reinforce men's hegemonic masculinity, which may be a distal factor potentially increasing risk for sexual assault perpetration.